This is the quick performance video of the 90-90 hip lift. So what I want you to do, lie on your back, heels up on the chair, stool or bed, low back is flat to the ground. If you have a left lumbar curvature, you can put 2 pads or a rolled up towel right under the apex, which is usually, you can come up to the pelvic rest here on that pelvis, come up about 3 finger breaths off of it with the pads under. Okay, you're going to do 3 things with the lower legs. First, you're going to push your heels down into the chair. Then, you're going to squeeze a ball, roll of toilet paper, whatever you have in between the knees. Next, you're going to lift your knees 1 inch up in the air. Okay, your lumbar spine, your low back is not to leave and lift up or arch up. You want to use the pulling the heels, squeezing the ball, and lifting the knees at the same time. Okay, once that's in position, I want you to put a little bit more pressure through that left leg, pulling the heel down while pushing that left leg in. You're going to see your left hip, knee drop down a little bit more than your right. Again, left side working a little bit harder than the right. Arm up. You're going to take a deep breath in for 4 seconds, pause for 2. Exhale for 6, pursing the lips. As you exhale, you're reaching up actively, not trying to come up, but you're trying to pull those left ribs down, in, and back as you're working that left side all together. You're going to hold that position with your ribs down. Try and hold that position as you take another breath in for 4. When you breathe in, if you feel a rib hump here on your left side, we know that your ribs are not in a downward position as necessary. And what we really want to focus on is breathing out as far as we can to that end range of exhalation for those ribs to drop down, and you can actively try to pull them down and in toward the pads in your back or toward the table as you do that. So again, you're going to try and hold that position, working the left leg, breathing in, expanding that area, and with each breath you're going to reach up a little bit further, refine pulling that left leg, getting that rib cage down, expanding on the inhale, and then trying to hold that expansion and pulling that left rib cage down, reaching up on the exhale. So again, 3 things to think about for the legs: heels, knees together, lifting the knees up. 2 things to think about on the upper body: staying active, reaching up, pulling that left rib cage down. All right? And again, holding that position while you learn how to breathe in and exhale out, holding that left rib cage down is key. Thank you.